Well, this brutal sell-off today coming on a day when the president holding a White House summit on health care reform. Is this Wall Street's way of saying the government is trying to do too much and spend too much too fast amid a financial crisis? With us now, Democratic Congressman Joe Sestak of Pennsylvania. Congressman Admiral, wonderful to see you. Thank you so much for coming in.
Good to be back.
I know the president sort of has mixed feelings about Wall Street, as we all do at this point, but when you look at numbers like this, do you think the market's trying to tell you something about how much Washington is spending?
What I think it's saying, if I want to address the health care first, is I think it's saying we actually need it now if we're going to shoot ahead of the rabbit. We know from the Institute of Medicine that we actually lose productivity of $100 billion a year because we don't have the uninsured coverage. We also know the cost is about $260 billion a year because of the 80 million Americans that have only partial or underinsurance as well as uninsured. So to my mind is, with regard to the health care proposal he has, is this is an opportunity to have our health services get a bigger piece of the market, and with competition and transparency, ultimately discipline cost. To the larger question, no. We all know from history, particularly Great Depression, that if the government acts boldly and aggressively, it is the only way that we can salvage a deep depression rather than a tough, harsh recession. And it just will take some time.
Representative Sestak, it's Liz out in Santa Barbara. I have to tell you, I agree on many levels with what you're saying, but I'm a doctor's daughter, and here's what I worry about. My dad used to complain that when the insurance companies got involved, the quality of medical care really went down because there were people who really didn't know what they were doing trying to help make decisions in this process. Doctors out there need to know that they're still going to be able to reach for the stars when it comes to the quality of medical care without being nickeled and dimed. And I think when you mix government and medical care, you really worry that the quality might come down.
You know, I think you're absolutely right. I got into this race after 37 years in the Navy because my daughter had a brain tumor. Given 3 to 9 months to live at the age of 4, I was in TRICARE. And I have to tell you, it was really hard in trying to find out what was the best brain surgeon, the best chemo, the best radiation for her to get. And that's why I emphasized it's just not competition. I said competition and transparency of standards will discipline costs. It's why President Obama is correct to have one public health care plan that you can opt to in order to make sure that those insurance companies understand that they're going to have a government competitor, because I cannot agree with you more. If you are able to see, like I wish we had been able to on Wall Street over the last few years, the transparency to see what was going on, to see what your best choices were, then we might not be in the Wall Street mess we're in today. And I believe, as your father well pointed out, that you and I would have had an easier time and more comfort of making sure that we were getting the kind of care we needed. Transparency, as well as competition, best disciplines cost.
By the way, how is your daughter doing, Congressman?
We're very fortunate. We just had a nice clean MRI about 3 weeks ago, and she's, about 20% of the kids make it, and she's going to be one of them.
That's great news.
She is one of them.
That is good news. Well, let me just bring it back to the market if I can, because of course we're focused on that. Perhaps too much so. There is an economy, a larger, broader economy out there. But to what extent do you think the market affects the broader economy?
I think it helps or hinders the psychology. And I actually think that what they're really responding to is not what our fiscal plans are. I think the expectations are already there. What they're responding to is our slowness in order to get back into getting the mother milk of our economy, credit, flowing again. When our Secretary of Treasury came out 3 weeks ago and dashed expectations without a firm, bold plan, now you see elements of it coming out. That's what the market's built upon. Believe it or not, it was the credit that got us into this problem, but it's going to be credit, being able to leverage our way out of it using the Treasury and the Federal Reserve TALF program that's going to get us out. That's what's going to restore the confidence in the financial system so the markets recover. I'm convinced that's it.
All right. Well, Congressman, of course, the markets want to see action first because they're too happy with what happened at TARP. So far, they've given TALF thumbs down, so we'll have to see what happened. Congressman, we've got to leave it at that. Joe Sestak, wonderful to see you again. We're glad your daughter's doing better. It is a